Hello and welcome to JAMA Network Open Conversations. I'm Angel Desai, Associate Editor for JAMA Network Open. Today we are speaking with Dr. Sophia and Dr. Laura Gibson about longitudinal study on the impact of the Philadelphia beverage tax on prices, purchasing, and individual level substitution in a national pharmacy chain. Welcome to the both of you and thanks so much for speaking with us today. Just to begin, can you please introduce yourselves?
Yeah, thanks so much for inviting us today to speak with you. This is Sophia speaking. I am a postdoc in the Department of Nutrition at the Harvard T.H. Chan School of Public Health, and my research is focused on behavioral interventions to promote healthier food environments and nutrition policy evaluations.
My name is Dr. Laura Gibson. I'm an assistant professor in health policy on the research track, and I'm also a senior fellow at the Leonard Davis Institute of Health Economics. I'm the deputy director of the PEACH Lab, which stands for Psychology of Eating and Consumer Health, and our team's done a lot of work on evaluating the Philadelphia sweetened beverage tax and other food and nutrition policies. And I've led some of the work on the population level analysis of substitution that we did with store scanner data. But I formerly was working with anti-smoking labeling and media campaigns.
I was really excited to read this paper and to talk to you both today, as the use of taxes on beverages are a topic of great interest right now. With that context, tell us a little bit about the background of the study and what you did.
So in the US, there are 7 cities with beverage excise taxes, and many have been evaluated. Now, what's unique about our study is that the vast majority of the evaluations that have been conducted have used store scanner data not tied to individuals or self-report data. What we've been able to leverage is store scanner data that are tied to individuals, and that allows us to answer how individuals change their behavior in response to a beverage tax. In this case, comparing people in Philadelphia to people in Baltimore. We can answer whether individuals are buying the same amount of sugary beverages, but just in smaller batches more frequently. We can answer whether there was substitution to non-tax beverages. So a lot of different and interesting questions we can address as a result of this design.
Your use of data from loyalty card users at a national chain was very interesting, particularly as you were able to leverage this, as you said, to look at stores and cities that acted as controls. How did you go about conducting the study, and what were some of your main findings?
We were interested primarily in how the beverage price per ounce for tax beverages changed and changes in the mean volume of tax beverages purchased per transaction within individual cardholders. So I can first talk about prices. And what we found was that, along with many other evaluations, prices did increase. In this retail pharmacy chain setting, there was a 107% pass-through of the tax, meaning that the average price per ounce for tax beverages increased more than the 1.5 cents per ounce, which was the amount of the tax in Philadelphia. Now, this pass-through is more than what we see in supermarkets and less than what we see in independent corner stores, suggesting that pass-through does vary by retail setting. Now, it was the highest for sports drinks at 120% and lowest for energy drinks at 13%. Next, we wanted to see whether that price increase changed purchasing behavior, and it did. So individuals in Philadelphia compared to Baltimore were buying 7.8% fewer ounces of tax beverages post-tax, which comes out to 6.8 ounces in absolute terms. And for some context, in terms of a regular soda, that's about 80 calories and 22 grams of sugar per transaction that people were buying less of. Okay, so then some may say, sure, they're buying fewer ounces per transaction, but what if they're making smaller purchases more frequently? Now, with our data, we were actually able to answer that question. And we see that even at the month level, consumers in Philadelphia compared to Baltimore were buying 8.2% fewer ounces of tax beverages. So it holds up even if we zoom out. And then some may say, fine, but what if they're going to other retailers to buy their purchases? And that's a fair question. But first, other evaluations do show that sales decreased for tax beverages in supermarkets, grocery stores, convenience stores, basically across the plethora of retail settings. Not only that, but we see that the number of monthly visits per person in our pharmacy chain setting didn't change from pre to post tax. And as we would expect, people were actually spending more money per transaction. So based on these results, we can say that people were truly purchasing fewer tax beverages as a result of this tax in Philadelphia. And those results do align with store data showing reductions in sales. We also have some really interesting results related to income and substitution, and I'll let Dr. Gibson address those.
Yeah, I just want to underline that Yes, other evaluations of the Philadelphia beverage tax have been done, but they haven't had such a great data set to look at changes within people. So we saw similar findings when looking at pharmacies with scanner data that didn't connect to loyalty cards, where there was a 13% reduction across a large set of pharmacies in Philadelphia. Here we have an 8% reduction. But when we looked at among loyalty card purchasers who primarily shopped at locations that were in low-income areas, they actually reduced their purchases of tax beverage more. So it was 13% for people who were shopping primarily in low-income stores and only 7% for people who primarily shopped in other income store locations. The other really exciting part about having this individual loyalty card data is that we could look within individuals at how they might change what they're purchasing. Before we did that, we were just sort of looking overall to see were there increases in non-tax beverage purchasing. So if you're purchasing less soda, are you buying more of something else? And we did see that, yes, people were buying more water and milk and 100% juice, but the great thing about the data set is that we could look at the proportion of their total beverages purchased with the card, and that actually showed a decrease post-tax relative to Baltimore to 13% fewer tax beverages among the proportions that the cardholder purchased from pre to post-tax decreased by 13%. So they're actually getting fewer tax beverages once the tax is in place relative to the total number of beverages they purchase at that retailer.
1.5 cents per ounce tax on sweetened beverages with a subsequent associated 7.8% reduction in ounces of taxed beverages purchased per transaction is pretty remarkable. Along with the tax, were there other public health measures going on in Philadelphia around the same time that could account for some of the changes that you found?
So Philadelphia has been great in terms of public health measures to improve people's consumption of healthier items. But at the time that the beverage tax was implemented, I can't think of any other policy that was implemented that could explain why there was this decrease for taxed beverages. They have policies to try to reduce sodium consumption, but that was implemented later. They have policies to have labels on vending machines to promote healthier purchasing, but none of those coincided with when this tax was implemented.
Really, really interesting. Without stepping out too far outside of the scope of the study, what do you think are some of the public health implications of these findings?
We have definitely seen, not just in this data set, but other data sets, a big decrease in the purchases of tax beverages. And these tax beverages are sweetened beverages, and sweetened beverages is the largest source of sugar in our diets in the US. And so we really believe that these types of taxes have the potential of improving people's health and reducing rates of diabetes and tooth decay. We have some evidence in Philadelphia that it did reduce tooth decay among special populations. We haven't yet been able to see overall health impacts in the Philadelphia area. However, there is one study that showed in Mexico with a 10% increase in price of sweetened beverages that for adolescent girls, they saw a 3% reduction in the prevalence of overweight. That's by Grassner in 2022. But not many studies have looked at the actual health impacts. We've been able to see fewer sales. We're hoping that leads to less consumption, which will lead to health improvements.
That's great. So to kind of talk about that a little bit further, what do you think are some of the next important or potentially unanswered questions following this study that you or others may be conducting in the future?
So in a study that we did interviewing retailers and distributors in Philadelphia, we found that retailers actually preferred a state tax over a local tax because it limits the amount of cross-border shopping that can happen. And cross-border shopping just means that people are leaving the city limits where the tax is in effect to areas directly outside of the city where there is no tax. Now, there is cross-border shopping that happens in Philadelphia, but evaluations have shown that the amount that happens doesn't completely offset the volume decrease that occurs in the city. So we have several cities in the US with beverage taxes. Next steps would be to have a state level tax. Now, Dr. Gibson alluded to some of the unanswered questions in the area, which in the causal model for beverage taxes, we would hope that when purchases decrease, consumption should also decrease, leading to improved health outcomes. But so far, we haven't had any of those evaluations in terms of whether or not that's led to reductions in the prevalence of diet-related chronic diseases in the US. So it'll be important to understand how the beverage taxes in the US may have changed the prevalence of type 2 diabetes, for instance, or excess weight.
It's been a great discussion. Any final thoughts regarding the study or anything that we didn't cover?
I'd just add that one of the concerns people have with beverage taxes is that they're regressive and that they put more of a burden on individuals with lower income. And we don't really see that problem in our data at this point, in part because one of the things that I appreciate is the tax is actually getting people to purchase fewer of these less healthy beverages. You're getting fewer sweetened beverages. But also, if we look at the analogy from tobacco taxes, we've seen there that there's evidence that that short-term cost where folks who have lower income are having to pay more of the tax, that pales against the long-term benefits of the reduced use. So there's less out-of-pocket healthcare costs and less income loss to tobacco-related diseases. So we're expecting something similar would happen in this case. And also, especially in Philadelphia, but in other places, the revenue that is generated from sweetened beverage taxes is going for things like education or community infrastructure, workforce development. And so in Philadelphia, for example, they raised $409 million over 5 years for schools and parks and playgrounds. And so I think as much as we can design the taxes together with residents of low-income neighborhoods to make sure that we're really meeting the social and economic needs they want with the revenue generated, that's going to be a benefit for both the policymakers and the residents, in addition to the health benefits.
I just want to add that beverage taxes are just such a powerful tool to address the consumption of sugary beverages, which are not very great for us. These taxes are effective, they change individual behavior, and we do see that the revenue from these taxes lead to a transfer of funds from higher income groups to lower income groups, suggesting that they can help advance health equity. So state level taxes are potentially on the horizon, especially if we see retailers also supporting taxes at that level.
Those are some really great thoughts to end on. Thank you so much to Dr. Sophia Hua and Dr. Laura Gibson for speaking with me today about this very important topic. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening.